Welcome back. In this video, we'll talk about the most commonly used drugs and their effects. We have PCP or phencyclidine, which is commonly referred to as dust or angel dust. This drug was initially manufactured as an anesthetic agent, but it was quickly discontinued due to its harmful and violent side effects. The hallmark is nystagmus and violence. So the most common complication of taking this drug is ER visits because of trauma. If the patient is combative and aggressive, use benzodiazepine like lorazepam and antipsychotics like clozapine. The effects of the drug are thought to be the result of two mechanisms: inhibition of NMDA and inhibition of the reuptake of norepinephrine, dopamine, and serotonin. With LSD or lysergic acid diethylamide, this drug enhances the perception cortex and activates the sympathetic system. This results in auditory and visual hallucination, and sometimes paranoia and depersonalization. And the sympathetic activation results in tachycardia and hypertension. Interestingly, the drug has a very unique feature. Because the affected cortex is in the temporal lobe, the perception and cognition is unaffected. So the patients, while hallucinating, know that these effects are from the drug. We only see this feature with this drug. Next we have cocaine. It's a very potent stimulant and it works in multiple systems. The drug usually lasts for less than an hour, and due to its stimulatory effect, it can cause hypertension, seizure, intracranial bleed, hallucination, paranoia, angina, and sudden cardiac death. Exam-wise, you'll find dilated pupils. To counteract the drug effect, the patient has to take an alpha blocker first and then a beta blocker. The new guidelines also adds oxygen and benzodiazepine. Next we have amphetamines, and these are also stimulants just like cocaine, with longer half-life and less potency. So expect to have the same findings with seizures, tachycardia, hypertension, cardiac death, etc. The hallmark, however, is teeth decay and prolonged violence. If the patient presents with psychosis, the treatment is antipsychotics like olanzapine. Next we have ecstasy, or MDMA. It's basically a modified amphetamine. So it's a potent hallucinogen with weak sympathetic effects. The hallmark is hyponatremia. The drug can also trigger serotonin syndrome in patients taking SSRIs. And here's a small quiz for you. Which of the following is the hallmark of the withdrawal symptoms of cocaine? The answer is hyperphagia and vivid dreams. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helps.